Sudhir, thank you very much for coming to Brazil and help us to manage this conference in Brazil. And how do you see the singular course in preparing people for the market and comparing this with other courses that you have ever seen before?
For me, Charles, this is a wonderful opportunity because I must tell you that you and Fabrizio and the team at the Singular are providing a world-class training. And when I say world-class, I mean it is world-class. I come from environment in America where I have worked in the world-class institution called Cornell. And what you guys are providing here is wonderful. Personally, I'm very fortunate to be part of this course.
And we know you come from India and now you are working in one of the biggest cities in the world, in New York. And how do you see Brazil and what we are offering for the patients comparing to developed countries as the United States?
This is a very important question you asked me because I do come from India and now I'm working in America where it's a very resourceful country. But what really matters and what really makes difference is more than the resources, is the physicians. Because I'm very so much impressed the way you provide here the best care in the world with the limited resources. I was working with the physician yesterday in the operating room, and with very limited resources, he did such a wonderful job. So my compliments to you and your team and Fabrizio and everybody, the work you are doing, because you have not let the resources affect you and limit the world-class care to your patients.
Recently, you received one of our fellows, Karen, who was there with you and your team. And what was your impression?
My impression was actually wonderful. People may think that we are teaching the international fellows, but that's not entirely true. We are actually learning from international fellows because the science is not exactly the science. It differs from different place and differs from different institutions. So what for me was very interesting to really learn from Karen is that we were providing the same care, similar care in a different approach. So I learned from her, and when I asked her if she had learned anything from us, because you and Fabrizio are teaching and training her with the excellent procedures. But she thought that she also learned from me because we were doing something different. So I think this is the first step into developing this international fellowship program, and I think it's going to be very benefiting to us as teachers, to them as trainees, and at large to the community, because now she will have some exposure of the so-called westernized medicine to come and implement to the local practice.
And what do you think for the future for interventional pain management?
I'm very fortunate and very honored to be part of this international pain community. If you don't know my background, I was a surgeon in India for 8-9 years, and then I practiced anesthesiology for 8-9 years in New York, and now for last 15 years I am practicing the interventional pain medicine. And if I have the opportunity, if I have a choice to do it again, I'll do interventional pain medicine again. And the reason is it's a very exciting, very interesting specialty, and it is going to stay here for many, many years to come. We are learning more cutting edge technology. We are providing the best help to our patient, best help anywhere in the world, and we are helping our community. But as I always said that we have come a long way, but we have a long way to go. We have a lot to learn, is still not there. But pain management, interventional pain management, is here to stay, and is going to be for centuries.
I know in some years you will be the president of American Society Interventional Pain Physician. What are you intending to do?
Well, that's very good questions, because the culture in America works slightly differently. We have a team we call executive board, and executive board is made of the couple of vice presidents and secretary and treasurer, and then there is a chairman. And the position of the chairman is more permanent, and the presidents change every year. But it's an excellent organization. It gives you the opportunity to make the changes. I don't know what I'm going to do. I still have time to learn and understand before I become the president. But it will be a very good opportunity to bring my point across, bring the new treatments across, and see whatever we can do to get the help from other people and try to make it something better.
And my last question, talk about your conference you manage every year in New York and New Jersey.
Oh, I'm glad you asked me this question, because I'm so biased about my conference. First thing is, I started where there was nothing there. The first conference was done in 2011, and that was done because I left Cornell and I was missing out the teaching opportunities, and now it is getting bigger and bigger. It's a national conference now, and every year, last year we had close to 500 registrations. This year, the first time, we are starting called international session, where we have speakers from Brazil, from Italy, from South Africa, from Mexico. So it is getting bigger and bigger and better every year. Every year we are bringing something new for the residents, for the fellows, for other parts of our community. So it's getting bigger. I don't know. I want to make this one of the best conferences in the world.
Congratulations and thank you very much again.
Thank you for the opportunity. I'm so happy to, and I'm going to come here every year, and I hope you invite me.
Next year we will have the Sobramidis conference.
Yeah, thank you so much. Thank you very much. And I know you are the president now, and you must be feeling very proud and a lot of pressure, because now you have the same responsibility to bring it bigger and better to your community and in South America. And I'm looking forward to you and Fabricio to have this one of the world place, because the world work you are doing is really unbelievable, and it comes from bottom of my heart. You guys are really doing a tremendous work, and I want to see it growing bigger and better every year. So thank you and compliments for that.
Thank you.